but we're still going, these are bills that have come to committee. Okay, this is Senate Finance, we're back live. We are going over, and I don't have it because my computer is not accessing the finance page.
I did print out a copy of the bill and put it
You
there.
gave me a copy of the bill,
Yeah.
okay. All right, this is 166.
No, this is
No.
230.
230. I've got 164, 160. And these in this file you put it? Nope, that's
You have the school documents that I put on your desk.
mental health school document. Roxbury Public School, there it is, under the schools, okay. So, Jen, this is 230.
This is 230. Just happen in the Zoom room here.
Medicare Advantage and supplement plans. We're getting a lot of Medicare this year in here. Health insurance.
Can you give me screen sharing rights?
Oh, yes.
Great. All right. Here we go. Jennifer Carvey, Office of Legislative Counsel, and we are looking at H230, which is an act relating to Medicare Advantage and Medicare supplemental insurance plans. Before I start walking through the language, I just want to give a brief overview of what those are, what the differences are with those. So traditional Medicare, original Medicare, you're familiar with Medicare Parts A and B. Then 20 or so years ago, Medicare Part D, the prescription drug benefit, was added. Those are all federal programs. Medicare Advantage is a private insurance product that private insurers can offer that provides the benefits that are available through Medicare Parts A, B, and D. Medicare Advantage is sometimes called Medicare Part C. In fact, I think it's referred to that way in some of the federal laws.
So the rest of this is called Part C, Medicare supplemental insurance.
Medicare supplemental is different, so that's the different.
No, I know it's different, but is that Part C also?
No. No. So Medicare Advantage or Medicare Part C is the comprehensive package of benefits available under original Medicare, administered by a private insurance company, and often may include other benefits besides those that are available, but may have a different provider network and different terms for prior authorization and otherwise than are available through traditional Medicare. Medicare supplemental insurance plans are for people who are on original Medicare, and they help with the out-of-pocket costs that the Medicare beneficiary is responsible for. So by buying that plan, it lowers your deductible, lowers your co-payments, because you're paying it kind of through premiums. So they don't work together. You're not on both. You're not on both a Medicare Advantage and a Medicare supplemental insurance plan at the same time. Medicare Advantage plans are fully federally regulated. State does not have a role in regulating the rates or dealing with denials of service or network adequacy, any of that. It's all federal. Medicare supplemental plans, the state, the Department of Financial Regulation does regulate to some extent. They can't necessarily set the plan design. Plan design is set at the federal level and is standardized across all states. But Vermont does have authority over how the rates are calculated and when and how the plans are issued. And so we have community rating for Medicare supplemental plans, just like we have in the major medical insurance market, just specific to the Medicare supplemental market. And they can rate differently for people who are eligible for Medicare by virtue of age versus those who are on through disability status. But otherwise, the community rating applies across the insurer's book of business in the Medicare supplemental market. So that's basically the overview before we get into what the language of the bill says. The first three sections of this bill deal with Medicare Advantage plans and state employees and state employee and state retirees. So the first section is amending a provision of Title III That's group insurance for state employees. This is how the state employees get their health benefit plan. And last year, language was added that specified, based on some proposals, that the Secretary of Administration shall not contract for any group, hospital, surgical, medical expense insurance. Major medical, it's the way it's described, or the term is used in the existing statute, that provides a Medicare Advantage plan or similar plan established under Title 18 of the Social Security Act. And the current law language says, without the explicit agreement of all employee organizations certified pursuant to chapters 27 and 28 of this title. So these are the state employees and the judiciary employees unions. This bill would take out without the explicit agreement of those unions, and would just say the Secretary of Administration shall not contract for any group insurance that provides Medicare Advantage or similar plan. And that same language is struck in two other sections dealing with the last best offer and State Employees Labor Relations Act, Section 2, and the Judiciary Employees Labor Relations Act, Section 3. So again, striking out that unless the parties all agree to the language. So regardless of whether the parties agree, this would prohibit Medicare Advantage plans from being
Prohibit retired state employees from deciding that they might like Medicare Advantage.
As the benefit that is offered.
Yes.
So, and I said retired, I think this is really for active state employees. But yes, this would say, so for those who would be age eligible or eligible by virtue of disability for Medicare while a state employee, the option for them could not be a Medicare Advantage plan. There had been a proposal last year, 2 years ago to do that, and there had been some concerns.
We will have to have I assume Senator Harrison is the primary sponsor.
Yes.
We will have Wendy and tell us why she thinks state employees shouldn't be able to make that decision. I think last year we said somebody couldn't make it for them.
Right.
But Advantage plans could change in the next 5 years and could be something that, and this says, if it is, they couldn't make the decision to change. I assume unless we change it.
Right, you could change the law. But yes, this means instead of negotiating, back to the original part, and so it just is a blanket prohibition. Without the escape clause of unless the parties agree. Okay, section 4 deals with this existing statute on community rating of Medicare supplemental health insurance policies and offering them. So this section says that a health insurance company or the other types of health insurers that offer a Medicare supplemental insurance policy shall guarantee acceptance of an individual's application for coverage and shall not make any premium rate distinctions or charge any additional fees or penalty amounts for an individual who meets certain requirements. So otherwise there's not guaranteed acceptance except within, I think, the first 6 months or so that you're on Medicare, and there can be a higher premium or other kind of financial penalty for not signing up for Medicare supplemental plan when you first sign up for Medicare.
So they drive a few of them out of offering in Vermont.
It might. There are some other states that have various versions of guaranteed issue and no financial penalty for people joining at other times. I don't know what the experience has been in those states. So the instances, the circumstances under which somebody would be eligible for this guaranteed issue and no financial penalty or additional premium would be if the individual was previously enrolled in a Medicare supplemental policy, but stopped that coverage to join a Medicare Advantage plan, which is allowed under federal law, or the individual joined Medicare Advantage when they first became eligible for Medicare. So if they meet one of those two, either they were already in Medicare supplemental and then switched over to Medicare Advantage, or they joined Medicare Advantage right away, they have left or want to leave coverage in the Medicare Advantage plan and have enrolled or re-enrolled or want to enroll or re-enroll in Medicare Part B. So if they're trying to leave a Medicare Advantage plan
I thought there was, isn't there a fee or a penalty?
There can be in Medicare supplemental plans, there can be an additional premium or financial penalty. This would say you can't, the insurer could not impose that under these circumstances. So
Okay,
for
the
basically
insurer,
for people
I
who
thought-
are trying to go from Medicare Advantage back to original
Okay,
Medicare.
I thought there was a fee from Medicare.
I think there may be penalties if you had, if you didn't sign up for Medicare within the 6 months,
Yeah,
I think 3 months before and 3 months after your 65th birthday, there can be some additional cost or penalties for joining later on. In this case, we're probably, it looks like we're looking at somebody who was enrolled in Medicare during their initial window, but at some point, either earlier or later, went over to Medicare Advantage and now wants to get out of Medicare
and
Advantage.
that's where I thought there was an ongoing penalty.
I think as long as you had, from the feds, I think the penalty is only if you didn't sign up for Medicare right away when you
Okay,
turned
I'll
65.
have it was Mike Fisher, I remember
Yes,
saying that.
Mike
so
Fisher is definitely
that's what he does.
much more in the weeds on this.
So I
So
will,
I encourage you to, yeah, hear
when
from
we
him.
take this up again, we'll have Mike in, but first,
All right, so we've got these three things. So somebody was either on Medicare supplemental, but left to go to a Medicare Advantage plan, or has always been on a Medicare Advantage plan since they first became eligible. And they want to get out of Medicare Advantage and come back to Medicare Part B, so they want to get supplemental coverage to go with it. And they submit the application for Medicare supplemental coverage within 60 days following their birthday date. So this is a time limit. It's not any time during the year, but within that window. If you meet all the three of those conditions, this bill would say guaranteed acceptance, and you don't have to pay the insurer an additional premium or penalty. Section 5 is to try to get at advertising and marketing of Medicare Advantage plans to the extent we have any, I doubt we can ban them.
I'm so tired of
for
Joe Namath
various
telling me to
reasons,
hide that insurance.
But this would direct the Department of Financial Regulation to undertake all measures not prohibited under federal law to regulate the advertising and marketing of Medicare Advantage plans in this state, and would prohibit anyone from advertising or selling a Medicare Advantage plan to an individual in the state who is enrolled in Medicaid or in a Medicare savings plan, which is when the state helps or pays the premium for Medicare on behalf of the lower income.
So they're in a state finance program.
Sorry?
They're in a state finance program.
Exactly, yep. All right, the next couple of sections deal with commissions and service fees and other financial incentives for brokers and others in the insurance business to sign people up for Medicare Advantage. So this says that a person licensed under this chapter as a broker or producer shall not accept a commission, service fee, brokerage, or other valuable consideration for selling, soliciting, negotiating, or otherwise orchestrating the sale, enrollment, or other participation of a Vermont resident in a Medicare Advantage plan or similar plan established under Title 18 of the Social Security Act, which is Medicare. And Section 8.
Just to understand that, what that essentially says is that a company that sells Medicare Advantage plans that is also licensed by Vermont, for example, Blue Cross, for example, is prohibited from getting any compensation for selling a Medicare Advantage plan?
Yes, this would prohibit, as I read this, it would prohibit them from taking a commission, so taking any kind of additional amount over the premium for
If they
signing somebody up.
Sell a credential,
Mhm.
any other kind of insurance, are they prohibited from taking a commission?
Generally, no, but you can see this is sort of mirrored on the provision just above it, which was enacted a few years ago, which says that you can't get a commission for signing somebody up for basically a healthcare sharing ministry.
Yeah, but I think those
Right.
weren't insurance. I think that was the problem with those.
Well, I mean, this is obviously it's designed to prohibit the expansion of Medicare Advantage. You know, if you look at what this
Right.
does, so
Yeah,
that's what the
Yeah,
intent
it
is pretty
is.
clear. And I know that there's a lot of pressure to ensure that the state doesn't try to force state employees into Medicare Advantage, but this goes far beyond that. This is anybody.
I'm concerned about saying that they can't choose to do that. I mean, and I know there are concerns about Medicare Advantage. I would like to make sure that you have to disclose that your nearest doctor is in Connecticut, or the nearest dentist.
To look at all the restrictions and so on that seem to affect people, and also some of the problem areas that have been reported to me, but I'm just very concerned about this being quite heavy-handed in terms of making an absolute prohibition on people's choices, which may be a choice that I don't agree with, but
Yeah,
hasn't.
well, I think first, we need to hear, obviously,
Yeah.
I don't have any, I know UVM wasn't as on and off and is still negotiating. I know that it's more difficult to get payments.
For some people, yeah.
But I think I want to hear some actual people that weren't able to get the service they needed, that they should have gotten, and maybe we'll ask DFR if they've had any complaints, something like that, see if we can figure out how big is the problem before you decide, are we using a sledgehammer to kill a fly here? And
Senator McCormick.
Senator McCormick,
Thank you, Madam Chair.
picture out
Yeah, just to continue the discussion here, I have a libertarian concern as well. The idea, if you got willing buyer and willing seller, I don't know if people need us to protect them from their own decisions. Having said that, the state does do things like we outlaw quackery. We outlaw. There are various bad practices that we don't leave it up to people to have to protect themselves, and so my first instinct is libertarian. I'm with Randy on this, but I think we can carry that too far. So I'm willing. I want to hear why this is necessary.
Yeah, and we will do that. We'll first have the sponsor in and ask her why she thinks this is necessary. And then, go from there and see if we can build a case about why it's necessary, and then we can decide how much is necessary. So.
Last section?
Yes, let's finish.
Last section is sort of a continuation of the previous idea. That one was saying no commissions for signing somebody up for Medicare Advantage. This is a provision around the Department of Financial Regulation and the commissioner suspending, revoking, or refusing to continue or renew any license under this chapter if the commissioner finds that the licensee did certain things. And this one is under unfair trade practice or fraud, and says it is an unfair practice under this section for a licensee to, scroll down, you get to the rest of these are just stylistic. Sell, solicit, or negotiate the purchase of a Medicare Part C plan, also known as Medicare Advantage plan, to an individual who is enrolled in Medicaid or in a Medicare savings plan. And then it defines the term Medicare products, which was used as well to specify that Medicare Part C is also known as Medicare Advantage, just because people get confused.
So when I'm putting an ad on TV, I don't know who's watching it, but you are definitely trying to sell or solicit people into buying your Advantage plan. And you put celebrities that are there to encourage it. And there's the little old lady with the glasses who doesn't like anything, but decides she likes the Medicare Advantage plan. So this is pretty much saying you can't sell it in the state of Vermont.
It's not actually saying that, but it is providing some disincentives.
Okay,
Yeah, you can sell it all you want, you just can't get paid for it.
yeah. Okay. Yeah, so to do something that harsh, I think we have to determined that there's an equally harsh evil being done to the people of the state. And that,
And I mean, there are lots of examples around where people have been, in effect, victimized in that they
Yeah.
haven't been theoretically told what the downside is of doing this, because they can't get coverage that they want, or can't get it at a reasonable price or reasonable availability and so on. But this goes quite a lot further than
yeah,
that.
it does. So we will start looking. If anybody knows anyone that should come in and talk, talk to Wendy and Jenny and everybody else on there and see if they have people that, you know, stories they know that can get us in line with things that have happened that motivated them.
Invite Joe Namath.
Right, Joe name? Or Jimmy, what's his name?
Yeah.
I don't know, they weren't on this year, just a little old lady with the glasses that screams. Okay. Okay, committee, I think that's it, thank you, Jen. I've got next week, we're gonna start looking at that, fund to keep the paid TV access open. We're trying to figure out exactly what it's gonna cost and, what might happen to rates and other things if we do it. We're also we're putting off the CUD bill until CUD day, which is the 31st. And we're going to be doing, the other one we did this week, public and community media benefits. That's all. Okay, we're gonna take a look at the state funds for credit unions. I think that'll be one or two witnesses, the credit unions and the banks. And maybe some other people that would be supporting it. Nope. And, other than that, we're gonna keep working it through next week and try to get the bills out of here. Because sometime we're gonna have to figure out what's gonna happen with property taxes. And I think you heard today, there is no silver bullet. And it's gonna take us a while. They've got a roll call already upstairs. Okay,
And it
it's
is
snowing,
snowing.
yes,
Madam Chair,
yes.
thanks for accommodating us on Zoom. I presume that Mark will be doing Zoom again tomorrow, because he actually tested positive for COVID.
Yeah, I have, Mark did not zoom in either for this or for finance or for the floor, but I don't think he gets, internet at the quality that allows Zoom up at his home.
Right.
And so if he's isolated, the pro tem's office was gonna check and just make sure it was okay, but I think
I'll be on Zoom tomorrow.
okay. I think everybody on Zoom, Randy and I are tired of being the only bodies in the room.
Yeah.
If one of us gets sick, we're in real trouble.
Sure.
So Zane, you'll get us the secret codes again?
Yes.
Yeah, we'll get y'all, get in tomorrow.
Yeah.
Okay, all right.
Madam Chair, are we going to try to vote out the abatement bill this week?
I have that on for possible vote for Friday, which is tomorrow.
Yeah.
And we have a fiscal statement, which I believe Zane has posted and it's up, but it's 1.5 million.
Okay.
That came from Julia.
I think it's the chair's decision whether or not people can vote remotely.
I asked the majority leader and she said she thought in committee it was.
Right.
And if I don't let you vote, we can't do anything.
Right. Okay.
So-
Well, if push comes to shove, I can walk 2 doors down the hall.
I know, and we'll all put on masks, but
Actually, Madam Chair, I'm exactly a mile from the State House. so I could
I
get down
know.
there fairly quickly.
Okay, but that was what I was told, and